So today we are at the Mylab counter, and this company needs no introduction in Pune at least. So it's a very big startup, biotech startup, which has done some great work on producing a first COVID kit, self-testing kit. And I myself saw this when I went to my local pharma shop, as well as they have developed a number of other innovative products. After this, during this whole COVID crisis, this information has come out what they have developed. So we will ask them further what they do and how they go about doing things. Tell me, ma'am, Dipti, ma'am, what's up?
So, sir, as you know that we have during COVID we had developed the first RT-PCR
First RT-PCR
test.
Yes.
So along with the test, we also have manufactured an automated system.
Right.
Because, for RT-PCR,
Okay.
during that time, obviously there was a huge demand of RT-PCR
Right.
test.
Right.
We have developed an automated machine.
Okay.
Where, there's a single system.
Okay, this is the machine, I guess.
This is the machine.
Right.
And it's basically a complete automated system where it performs extraction as well as RT-PCR
Okay.
in a single run.
Okay.
And at a time you can process 8 samples.
Okay.
In this run,
Okay.
in this machine.
Okay.
Where you just have to place the sample
Mhm.
and you will get the RT-PCR reports directly.
Right.
So there is no minimum manual intervention that is required.
Okay.
And with a touchscreen display with a minimum amount of samples. So
Right.
we have optimized it where you require only 1 ml of your sample
Mm-hmm.
and you can process.
Right.
And as I said that simultaneously it can run 8 samples.
Okay.
It is a touchscreen.
Okay.
All the protocols are already there in the machine.
Okay.
So, actually you have to just select the protocol and run the samples.
Okay.
Again, it is a cartridge-based system. So for a single sample, single cartridge is used. So no contamination.
Okay.
As well as I said, you don't require a skilled person to operate it. Even there are few steps that you use, and depending upon the test. You can run the entire extraction to RT-PCR in 2 to 2.5 hours.
2 to 2.5 hours.
Correct. So
Right.
for a molecular lab, you require a huge setup. What we have done is we have, got all the entire setup in a box.
Lab in a box.
Right.
Correct.
Right.
This is
So
the
basically, it's like
concept.
I'm going back 15 years when I was in this field. So in those days, there was a device which had come or not. I'm not sure. But where you take a leg of a mosquito and you put it inside a machine, and on the other side the results would come out, that way. So
Correct.
I'm a bit hazy, but
Correct.
basically it's everything all in one. You have
Correct.
produce
So
something like
that's
that.
why we have named it as a lab in a box.
Right.
It's a compact DX system.
Right.
And as we said, that it is compacting the entire molecular lab into a single system. Again,
Okay.
it is a benchtop machine.
Okay.
So it does not require a large or huge
Okay.
amount.
But the
of-
size is a bit large at the moment, the first version at
Correct.
least,
So
the
we are
prototype.
working on-
So this is been launched already, or it's a prototype?
It's already been launched.
It's already been launched.
We have
Okay.
recently launched it.
Okay.
But it's already been launched.
Okay. Okay. So that's a pretty revolutionary bit of technology if it succeeds, because I think you will get lots and lots of orders.
Yes.
The next versions, the more.
Correct. And we have not only optimized, a single test. It gives a array of tests.
Right.
It could
Right.
be all your infections,
Right.
say malaria, dengue,
Right.
chikungunya,
Right.
COVID,
Right.
TB. So
Right.
currently, the ICMR has also approved our TB test,
Mm-hmm.
and which can be run on this
Okay.
machine.
Okay.
And apart from that, we have also manufactured some other instruments also.
Okay.
Where this is a dry luminescence assay analyzer.
Okay.
So basically, your antigen antibody machine,
Okay.
and it basically gives not only qualitative but quantitative identification based on the
Mhm.
fluorescence.
Okay.
And it again is a very compact design
Mhm.
with a touch screen, and immediately within 5 to 10 minutes you get the reports. The reports can be printed or shared through this device itself.
Okay.
And we have developed multiple parameters, cardiac markers. There are hormones that are already being developed on this machine.
Okay.
And again, it's we have AI. We are using AI also to make this machine more smarter.
Okay. 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 And this machine,
This is again so similar.
Similar.
Similar concept, but
Okay.
we are trying to have this. This probably could be placed in a lab or a hospital. We are trying to place this at the customer end itself.
Okay.
We are trying to bring the lab at the nearest possible to the customer.
Okay.
And we have, so this is basically our handheld X-ray machine, where now instead of having an entire X-ray setup done, you
Right.
can have a portable X-ray,
Okay.
and you can easily transport it to the remotest of villages
Right.
and do the screenings.
Okay.
So this is again, we have been working on TB and
Right.
active TB screening.
Okay.
This is another test that is developed
Okay.
by Serum Institute of India.
Okay.
This is basically Sci-TB. It's
Okay.
for detection of latent TB.
Latent TB.
Along with active TB, you need to screen for latent TB as well if you want
Okay.
to eradicate TB soon.
Okay. Okay.
So this is where this is a test similar to your TST, but then it does not interfere with your previous BCG vaccination, and it gives you the true positive result. And where you have to inject it on your arm and observe it for 24 to 48 hours.
Okay.
Post that, if there is an induration observed, then the patient can go ahead with the treatment.
Okay.
So this is basically, so this, we are simultaneously working on the latent TB as well as the active TB also.
Okay. Great. Great. And any other, means, what are the other things in the pipeline? I mean, you just can drop. I mean, if there is, you don't need to go into details, but anything.
Yeah, so as I said, we are working on a variety of
Okay.
different instruments. We are into instrument manufacturing. We are
Okay.
also into kits manufacturing.
Kits manufacturing.
Where we are working on different infectious panels. And as you said that, we have recently
Veterinary also.
launched a soil testing, machine.
Okay.
Where again, it's a portable machine where you can actually go and do the test and on the agricultural land and
Okay.
provide the results.
Okay.
So we are basically connecting the remotest of
Right.
locations
Right. Right.
to the cities and
Cities.
better testing.
Great. 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 So I'm going to put your contact number in the description. Whoever's concerned and who should be contacted by either commercial inquiries or research people who want to collaborate. And of course, Mylab is a very well-known organization. But anyway, we are able to cover this on this channel and have meeting of molecular biology as well as organic farming, etc. And that's what is required. So thanks a lot. Thanks today for your time.
Thank you.